Hi everyone, welcome back to my channel. So today we'll be discussing diabetes mellitus. Imagine eating a meal, but instead of the sugar entering your body's cells to produce energy, it stays trapped in your bloodstream. Over time, that sugar begins damaging your eyes, kidneys, nerves, heart, and blood vessels. That is exactly what happens in diabetes, one of the most common chronic diseases worldwide. In today's video, I'm going to explain diabetes in the simplest way possible. We'll cover what diabetes is, why it happens, the symptoms, how it's diagnosed, and the complications you absolutely need to know. And by the end of this video, you're going to understand diabetes better than most students who spend hours memorizing it. Before we talk about diabetes, we need to meet the star of today's video, the pancreas. The pancreas has two major jobs. First, it helps digestion by releasing digestive enzymes into the intestine. But for diabetes, we're interested in its endocrine function. Inside the pancreas are clusters of cells called the islets of Langerhans. The beta cells produce insulin. The alpha cells produce glucagon. Think of insulin and glucagon as a team. Insulin lowers blood sugar, glucagon raises blood sugar. Together, they keep blood glucose within a healthy range. The moment insulin becomes absent or ineffective, diabetes develops. So remember this: beta, insulin; alpha, glucagon. If you remember only one thing from this slide, remember that. Now, let's understand insulin using the easiest analogy. Think of insulin as a key. Think of your body's cells as locked rooms, and think of glucose as people trying to enter those rooms. After a meal, blood glucose rises, right? The pancreas detects this and releases insulin. Insulin acts as a key that unlocks the cell door. Glucose then enters the cell and gets used for energy. As glucose enters the cells, blood sugar levels fall back to normal. So it's simple. Food increases glucose, insulin opens the door, glucose enters, blood sugar normalizes. That's normal physiology. Now let's move on to type 1 and type 2 diabetes. This is where things start going wrong. So there are two major types of diabetes. Type 1 diabetes happens when the body's immune system attacks and destroys the beta cells in the pancreas. No beta cells means no insulin. No insulin means glucose cannot enter cells. These patients need insulin for survival. Type 1 commonly affects children and young adults and usually develops rapidly. Now type 2 diabetes is different. The pancreas still makes insulin, especially earlier on, but the problem is that the body's cells stop responding properly. This is called insulin resistance. So the key is there, but the lock is not working properly. Type 2 is much more common and is often associated with obesity, lack of exercise, and family history. So remember, type 1, no key. Type 2, broken lock. Now let's connect everything together. Whether it's type 1 or type 2, glucose cannot enter cells effectively. So glucose starts accumulating in the blood. The kidneys try to remove this excess glucose, but then glucose pulls water with it. This is what causes excessive urination called polyuria. As the body loses water, the patient becomes thirsty. This causes polydipsia. At the same time, cells are starving because they cannot access glucose, so the patient starts feeling hungry all the time. This is called polyphagia. And just like that, we've described the famous diabetic triad. When a patient develops diabetes, they often present with classic symptoms. The big three are, like we said, polyuria, which is frequent urination; polydipsia, which is excessive thirst; polyphagia, excessive hunger. But that's not all. Patients can also develop unexplained weight loss, fatigue, blurred vision, slow wound healing, frequent infections, and tingling or numbness in the hands or feet. So, if a patient tells you that they're constantly thirsty and waking up several times at night to urinate, always think about diabetes. Now let's diagnose diabetes. There are 4 major tests. Number 1, fasting plasma glucose. A value of 126 milligrams per deciliter or higher suggests diabetes. Number 2, we have HbA1c. This reflects average blood sugar over the previous 3 months. A value of 6.5% or higher indicates diabetes. Number 3, random blood glucose. If it is 200 or more with classic symptoms, diabetes can be diagnosed. And number 4, the oral glucose tolerance test. A 2-hour value of 200 or more confirms diabetes. And we have 3 categories here. We have normal, pre-diabetic, and diabetic. So it's important for students to memorize these values in order to diagnose properly. Now let's talk about emergencies. The first one is diabetic ketoacidosis or DKA. This is most common in type 1 diabetes. Patients develop high glucose and ketones. They may have fruity smelling breath, abdominal pain, and deep small breathing. The second emergency is hyperosmolar hyperglycemic state or HHS. This usually occurs in type 2 diabetes. Blood sugar becomes extremely high. Patients start becoming severely dehydrated and confused. The third complication is hypoglycemia. This happens when blood glucose drops below 70. Symptoms include sweating, tremors, palpitations, and confusion. So remember, DKA ketones. HHS is extreme dehydration. Hypoglycemia means low sugar. This is the slide every medical student should know. Long-term high blood sugar damages blood vessels. The eyes can develop diabetic retinopathy. The kidneys develop diabetic nephropathy. The nerves develop diabetic neuropathy. The heart develops cardiovascular disease. The feet develop ulcers and infections, and poor circulation can lead to peripheral vascular disease. So, a common exam question could be, which organs are most commonly damaged by diabetes? The answer is eyes, kidneys, and nerves. Let's move on to management. The good news is that diabetes can be controlled. Management starts with lifestyle modification, healthy diet, regular exercise, weight reduction, reduce having carbs, smoking cessation, and proper food care. For medications, type 1 diabetes requires insulin. Type 2 diabetes often starts with metformin. Metformin decreases hepatic glucose output. We also have GLP-1 agonists. These enhance glucose-dependent insulin release. SGLT2 inhibitors block renal glucose reabsorption, and sulfonylureas stimulate insulin secretion. Good control today prevents complications tomorrow. Before you leave, let's summarize everything under 30 seconds. So diabetes is a disorder of glucose regulation. Type 1 is caused by insulin deficiency. Type 2 is caused by insulin resistance. The classic symptoms are the 3 Ps: polyuria, polydipsia, and polyphagia. Diagnosis is made using fasting glucose, HbA1c, random glucose, or OGTT. Uncontrolled diabetes damages the eyes, kidneys, nerves, heart, and blood vessels. If this video helps you understand diabetes better, make sure you subscribe because I'll be posting more simplified medical topics every week. Comment below which topics you'd like next, and I'll see you in the next video.